Hi everyone, my name is Luis Santiago and I'm the CEO of PEGASI, a startup dedicated to the smart management of healthcare information for the developing world, making it accessible, clear, and useful for patients, physicians, and service providers. In the war against diseases, cancer is the second largest battlefield in Latin America. These staggering numbers that we are seeing have made us declare war on cancer in 1970. Our combatants go into battle in a fragmented field where the helpers can't communicate. They go into battle with the best disposition. With fear, yes, but also with amazing courage. Their stories are unique, and we are losing them. Over 70% of the region's medical information remains unstructured, in most cases still paper. This is especially bad when treating cancer because every story lets us know our enemy better and learn how to defeat it. In order to solve this situation, we created a four-step method to structure, process, aggregate, and analyze all of the region's medical information. The first two steps we handled through PEGASI method, or Healthcare Information System. PEGASI method's value proposition is unique because it's the only one that works both offline and online. It's available on any smart device, offers an integrated and secure teleconsultation model, and uses international standards for interoperability and patient privacy management. PEGASI Med creates an ecosystem in which patients become the protagonists of their clinical care, controlling access to their shared history. There are multiple practitioners and their teams working on oncology-specific EHR, for which the patient can access services at home and get in touch with actors that can support them in their recovery, such as government, NGOs, and the medical industry. The business model behind PEGASI Med is a B2B, B2G, B2B2C model, where the size of the license depends on the amount of physicians enrolled. On steps 3 and 4, we use PEGASI BI, or Business Intelligence Platform. PEGASI BI converts anonymous data collected by PEGASI Med into big data, allowing the improvement of everyday clinical operations and service providers' paying relationships. Data for researching new medications, wearables, and prosthetics, and the part we're most excited about, real-time public health vigilance. The analyzed data is of interest for the medical industry, especially for the pharma sector, government, NGOs, and multilateral organizations such as IADB and World Bank. The PEGASI method means more efficient clinical care, which reduces waiting time and adverse events while caring for our fighters. In addition, the anonymous data generated will massively improve clinical processes, predict the course of the disease, and design consistent strategies. And groundbreakingly, we provide tools to investigate this terrible enemy from data with the real world. The team behind PEGASI is formed by technical personnel, marketing consultants, and our legal counselors, spearheaded by our officers who have more than 20 years of experience in the healthcare IT market. And traction shows we have been doing things correctly. We closed 2019 with over $55,000 in revenue, and closed 2020 with $130,000 in revenue and $40,000 in our pipeline. We have these amazing customers across 5 countries in both the pharma and the private sector provider sector. Some of the use cases we are implementing for our platform are patient contactability, clinical decision support via digital tumor board discussion tool, and personalized healthcare research using PEGASI. We are currently looking for $1 million in funding throughout 2021 in order to expand our reach to 8 countries and increase our revenue to 8 million. If you are an investor, a pharma company, or a cancer practice in Latin America, we are looking for allies such as you to never lose another valiant story in the global struggle against cancer. Please join us on this grand project. Thank you very much.
So I know you have a lot of traction and interest from pharma. Why don't you paint the picture for us and explain a little bit about what the use case is and how those relationships play out?
Thank you very much for that question. It's super interesting. We are in the process of signing a framework agreement with Roche for Latin America in order for them to incorporate our technology in any of the countries and support cancer community centers and hospitals throughout Latin America. It's also interesting that we are very close to Novartis in terms of developing products. And in the idea is for us to be able to bump out this huge amount of information that's usually in paper format and use it for the real world evidence departments. We handle through PEGASI the information that's structured and processed in an adequate manner for investigation from that information's inception. And then we provide those suppliers, like for example, Roche, Novartis, with the information in a format that they can use to analyze. So we are looking for other pharma companies in the region that want to perform the type of research and extend our platform to centers that really need it.
That's awesome. It's just amazing that 73% of medical records are still on paper in Latin America. You know, most people on this call are not in Latin America. So can you tell us a little bit more about the competitive landscape? What does the competition look like and the market look like in your space there?
Yeah, thank you. That's a very good question as well. Latin America is more a greenfield in terms of EHR, ERP introduction. Many clinics have ERPs but are not handling clinical records in any form whatsoever. Most of that information is still on paper. We, for example, had a public hospital in Venezuela that took around 8.5 hours to review 60 patients. And just introducing this type of technology, we increased that number to 180 patients throughout those 8 hours. So the increase that we can see on the level and the quality of the attention, just incorporating EHRs in the region is huge. We have another competitors, of course. For example, we have NimboX from Mexico. We have a couple of startups in Guatemala. In Chile, we have some competition. But kind of like their focus is more local. They are building for a single hospital, perhaps a city. The view behind PEGASI is to make it accessible for all the region as a whole. And then we can start building this dream of having a centralized medical record, which is extremely important as well on the oncology side.
That's great. Logan, I see you have a question. Why don't you come off mute and ask it for Luis? Appreciate
that. Luis, awesome presentation. Good to see you. I wonder what your thoughts are about kind of leapfrog innovation, the ability to look at some of the challenges faced by EHR vendors, let's say in the US or elsewhere, and obviously not just copying Epic and Cerner, but really learning from the lessons of the past to leapfrog forward.
Yeah, no, and that's super interesting, and thank you for the question. I think the key takeaway that we took from Epic and Cerner is that the price range can actually hamper your way to affect the society positively. And one of the things that we saw is that, for example, I was doing work with the Department of State in 2016 in the Young Leaders of the Americas initiative. And I saw that the new Presbyterian license for Epic costed $96 million. That's unpayable in Latin America. And what we have learned is that the benefit that you can get from giving this type of technology in almost a cost-effective way to physicians in order to structure that information will make you an actor that's extremely interesting in the data sense, not just in the SaaS sense. So we are learning more our experience from providers such as athenahealth, for example. And kind of like our guiding North Star in the building of PEGASI is a US company called Flatiron Health. They were acquired by Roche for $1.8 billion in 2018. And that's kind of like the way we are going forward. Flatiron started being a software as a service company to collect oncology HR information. And they became a huge actor in the creation of data analytics for the pharma companies. And that's why Roche acquired them. We are following that trend towards perhaps an M&A with Roche in the short term.
I love it. Always good to map out those big goals. So since we have some investors on here, why don't you tell everyone a little bit more about your raise? What are you looking to use the proceeds for?
Okay, yeah, thank you. And that's a great question. The first thing that we are looking the funds for we need to expand our development team. We are getting so much work asked from us. For example, we just kind of have to give development team for Wash because we are expanding with it really fast. And we have to hire at least 4 new developers. Our guys are like working 12 hours a day. It's really hard for them. And we then need to expand faster throughout the region. It's going to be much more valuable data if you take it from different places across the region. And then we could do this dream that we have of watching real-time public health vigilance for the region. And that, of course, expanding is expensive in terms of what you need to spend. But the opportunity in Latin America is huge. We don't have competitors that are thinking this big. We have very local players that haven't seen the huge advantage of having all this information in a digital format. So the market is open for us.